Good morning, everyone, and thank you for joining us. My name is Brittany Resendiz, and I'm the Member Communications Coordinator here at Commonwealth Purchasing Group. For those of you that are unfamiliar with our program, we are the leading group purchasing organization for community health centers and other nonprofit organizations. Today, we're very excited to have John Moynihan lead our discussion on improving patient outcomes with next-generation IT solutions. John has over 20 years of experience in the healthcare space as General Manager of the Healthcare Vertical at Extreme Networks. He is helping to define and prioritize new strategic initiatives within the healthcare vertical globally for Extreme Networks, visionary software-driven networking solutions. The webinar today is designed to last for 1 hour, allotting us 30 minutes for the presentation portion and 30 minutes for the question and answer. As you can see now, your line is currently muted. When we reach the Q&A portion, you may type your question into the question box, which is located on your control panel, or if you'd like to ask your question over the line, please use the raise your hand option, which is also located on the control panel. That will allow us to unmute your line so you can ask your question directly to John. At this time, I'd like to hand it over. John, thanks for being with us today. Why don't we get started?
Thanks so much, Brittany. I really appreciate it. And welcome, everybody. Welcome to the webinar, and I also want to thank the Commonwealth Purchasing Group for inviting me to speak with you all today. As Brittany said, my name is John Moynihan, and I am the General Manager for the Healthcare Vertical at Extreme Networks. Extreme Networks provides software-driven networking to over 2,100 healthcare organizations around the world. As Brittany said, I have over 20 years experience in healthcare, both on the clinical side and on the IT side. I actually spent 6 years as a CTO for an emergency telemedicine provider. We actually were a physician services group that provided emergency critical care for neurology and other specialties at the bedside through video conferencing and other teleradiology technologies. So I started with that company before we had our first hospital, and when I left, we were the largest in the world in terms of emergency telemedicine, doing over 60,000 emergent consultations per year. Extreme Networks is very, very focused on helping healthcare organizations deliver the best possible business and clinical outcomes through the use of technology. And we all know that healthcare IT is being squeezed between responding to today's technology megatrends and driving both operational business outcomes as well as clinical outcomes. We've actually helped with that. So we actually are a global company in terms of how we provide services to healthcare. For example, we helped a healthcare organization in Germany transform their outdated network into one that could give them, any user, from doctor to patient, secure role-based access to any of their medical records on mobile devices. And we've enhanced the quality of care for over 37,000 patients across 21 clinics there. You know, developments in mobile, social, cloud, and big data and security absolutely demand a technology response. And IT has done so with initiatives like BYOD, IoT, big data and analytics, and also moving to the cloud. But the leaders in these organizations and healthcare organizations are more interested in reaching out to the people. We need to focus on the people, specifically getting patients and employees engaged in a way that they're used to, and in a way that they have become accustomed to with the advent of all the consumerization of technology that everybody in their everyday life uses. So how can IT bridge that gap and deliver those better business outcomes and clinical outcomes? Well, we believe that we have to build stronger connections with the patients, clinicians, and the partners. And we have to reposition itself so that we can enable those stronger connections, because the better connections with these patients and employees result in those better business outcomes and those better clinical outcomes. And how do we do that? Well, your network is the key. With using your network, it's the key to unlocking those connections, because it's the platform that touches your patients, your partners, and your employees. And they do it every day on a daily basis. We've built a reputation on helping organizations leverage the network to drive these kinds of business and critical outcomes. And we go even further. our software-driven networking solutions don't just deliver these kinds of operational business outcomes. They connect beyond the network and build even stronger relationships with your employees, your patients, and your partners. So let's talk a little bit about community health centers. So we all know here on the call that this is there's a lot of pressure going on in the community health center industry because there's a lot of pain points that are going on. You have to respond to increased quality reporting expectations. You have shortages in access to clinicians. You have to make sure that your EMR integration is aligned with all of the different groups that you're working with. And you have to prepare for those health emergencies with limited IT resources. So the bottom line is you have more patients with fewer care alternatives that you're trying to answer to. You're having issues with recruiting and retaining staff. And you have this increased emphasis on accountability. And there's disparities throughout the public health system that you are at the front line of. And so you need to be able to respond and react to these in a way that lets you be agile. And so having the technology support and foundation that gives you that agility is really important. So how is healthcare technology evolving? Well, this is a great quote, and I know it's around hospitals and not necessarily community health centers, but that's okay. I think it applies as well. And this is from Barry Runyon, who's the Vice President of Healthcare Research at Gartner. And he says, situational awareness is the engine behind various Hospital of the Future, digital hospital, and smart patient rooms initiatives. It's at the heart of a real-time healthcare system. So situational awareness means knowing who, what, when, and where is accessing your applications, is using your devices, and is coming onto your network using devices of their own. So being able to have the visibility into that is important in delivering that next generation healthcare IT network. And what are some of the drivers around what's going on? Well, first and foremost, we're trying to improve patient care. We're doing that while having to deal with patient privacy issues. We have HIPAA, HITECH, and others that demand that we make sure that any information that's crossing our networks is secure. We have the rapid digitalization of the entire ecosystem within healthcare with Wi-Fi enabled devices, everything's on the network, and then we have new ways to access data. So people are bringing in their devices that they use in their daily lives, their smart devices, their iPhones, their Androids, and they're using them as part of their clinical practice. And so we need to be able to manage that, and we need to be able to protect these clinicians from themselves when they do bring those devices into a network and they do decide to use them as part of their clinical day-to-day. So the problem with networks is the way that they are perceived. So traditionally, networks are just perceived as plumbing. So, okay, I need to put the networks in, I need so many ports, and I have to pass this much data. Well, plumbing isn't strategic. Plumbing is just infrastructure. And what we really focus upon is saying, no, what you have is not plumbing. What you have is an intelligent tool that helps you focus your business and focus your practice. But the problem is that leadership isn't always focused on infrastructure. I mean, there's a lot of examples of this where there's so many projects around EMR implementation, where people are spending, huge amounts of money to implement new EMRs. And what's happening is they spend all the money on the applications, they spend all the money on the training, and then they stand up the application, and guess what? It doesn't work. There's downtime, and there's issues. And what happened is the leadership just didn't focus on the infrastructure. And so everyone just assumed that the wireless would work. But hospital wired and wireless network requirements are complex. And the delivery designed with separate application network ownership, a lack of visibility and performance measurement challenges really take the network into a place that it hasn't been before. So it is now beyond that plumbing and now needs to become that clinical tool and that business tool. So that's what we at Extreme are striving to do. So if you think about a typical patient engagement, in a healthcare organization, and all of the different things that need to be aligned, and all of the different things that come into play, you realize just how complex, this single interaction is. It's a mix of patient services, diverse and specialized care teams, systems and applications supporting the care teams, governmental regulations, compliance and governance. So moving to a 21st century healthcare model, which now also includes remote and cloud and home health, can be daunting. And so we need to make sure that as we deliver software-defined networking, we're doing it in a way that's easy so that you can manage this really complex environment from essentially a single pane of glass. So let's talk a little bit about applications. So applications require intelligence. We know that all of these organizations, they're spending money on critical care applications. Every healthcare organization has multiple versions of applications that are used for different specialties. Everything is feeding back into the EMR. But who's using the applications? Are they using them properly? You know, when an organization spends all of that money and delivers these applications, they need a way to be able to see what is happening with adoption. Is it being used the right way? They have to be concerned about bandwidth requirements. So when are the applications being used? When are those, terabyte plus 3D reconstructions being transported across your network? Okay, is it bringing other applications down? The thing about providing intelligence is being able to use the network as a tool to drive behavior, so that you can actually drive the behavior of the clinicians and the patients that are coming into your organization and get them to use the applications in a way that gives you the best ROI. So when you're spending all this money, you're not worrying about how they're using it, because you can now track it, you can measure it, and you can go back and you can do forensics on it if there's any problem. And this helps you deliver that application and get the best bang for your buck when you're deploying them. So what do we do? So if you're still thinking networking is equipment, you really need to think again. It's much more than that, box that's in the closet with the 24 ports and the blinky lights. That's not what networking is anymore. Over the past 20 years, we've purposely evolved from a hardware manufacturer into a leading provider of software-driven networking solutions. And we began with the industry's most comprehensive and high-performance network access and switching platforms, from edge to edge, edge to core, wired to wireless. We then aggregated a comprehensive suite of software tools in a single pane of glass that allows you to effortlessly manage, secure, and analyze every user, every device, and every application on your network. And finally, we're extending control beyond your on-premise network into the cloud. So to your infrastructure in the cloud, it's keeping your network and applications in tune no matter where they reside. So if you think about, if you're in an organization that's in an acquiring mode where you're bringing on different partners and different physician groups and different health centers as part of one single organization, this cloud management allows you to leverage a network almost immediately upon acquiring, regardless of whether or not that disparate entity has a different networking scheme. We can provide that security and we can provide that management from anywhere. So, if there's an issue and you have 11 sites with 30 different closets that you have to address, we can manage that from a single location and a single pane of glass. So unlike other people who are chasing that SDN label, right, that software-driven networking label, we've built it from the ground up. And this evolution hasn't been haphazard or by chance. It's been driven by our vision. It's our vision of the network. It's as a force for building stronger relationships, as a force for driving business and clinical outcomes. So let's talk a little bit about what's going on the network and why the applications require visibility and control. So anyone on the call right now who's from an IT organization will understand that when there's a problem, almost 99.9% of the time, the first finger that gets pointed at the network. Oh, the network's bad. The network's slow. I can't do my job because of the network. Well, traditionally, IT managers and network managers have kind of had to take that on the chin because sometimes it's difficult to determine and troubleshoot what is actually going on. But if you provide an intelligence to the network, if you can give them the visibility and the management and control, you can actually reduce what we like to call the mean time to innocence. So basically, you can pull up your analytics and you can say, actually, the network is responding fine, but if you look over at this workstation, this PACS workstation, the application is slow. So that's the culprit. It's not the network. So not only are you giving your way to defend yourself and defend your network and what you're doing, but you're also providing a means to solve problems quicker. And if you solve problems quicker, that leads to better clinician satisfaction, better patient satisfaction, and better patient outcomes, because you're not spending all that time trying to troubleshoot and figure out where a problem is. You can immediately address it, and you can immediately fix it. So application intelligence and control, right? So we talk about, you know, everybody that's coming into your network. So there's this thing called shadow IT, or you know, there's rogue devices where people are bringing in their own kind of IT services and applications. Well, now you have a way to see those, and now you have a way to manage them, right? And it's this ability to monitor and report on the who, what, where, and when of how patient data is accessed that's vital to the healthcare organization. We provide that visibility into the clinician's experience regardless of the device or the application that they're using. So if I can give you an example, we have a healthcare organization in Berlin that we found that when they went to electronic systems, doctors, they couldn't afford to wait on the application times. And so they also couldn't figure out which applications were responding slowly due to network issues or due to the implementation of the application itself. So we came in and we gave them extreme management, control, and analytics, and they were able to quickly identify what was going on, where the problem was, and they were able to fix it and address the issues that were coming from the clinicians. So again, you solve the problems for the clinician. This leads to better outcomes for the patients. And let's talk a little bit about BYOD, right? So bring your own device. I sometimes like to say this is now BYOX, where X equals devices, services, even clouds. I mean, people are bringing in bots into their day-to-day work life. And it's because of this need to be mobile that's really shifted what's going on inside and outside of healthcare organizations. If you think about why this happens, all you really need to do is take a look at what you're carrying around in your pocket every day, your smart device, your iPhone. People are in love with their iPhones. They're, especially as you kind of come down into the millennial generation, they are in love with this device because of the way it works and because of the fact that they have access to immediately to tools that they sometimes never even knew existed, and in a way that if they like it, they use it. If they don't like it, they delete it, and it's immediate. It's actually a pretty interesting poll that went out that said that 65% of millennials would rather have their car stolen than have their phone lost. So that's the kind of value that people put onto these devices that they're carrying around. And on the healthcare side, clinicians are using these devices as part of their practice. And they're not asking anybody's permission to do that. They're bringing it in, they see a need, they use it, they find something they like, and they stick with it. So as IT professionals, it's our job to help them manage that. I mean, I can remember back in the day when BYOD was a new thing. And I can remember all of the hospitals that tried to put a stop to it. And they failed miserably because of the love that people have for these devices and the fact that they think to themselves, if I can get this kind of quality of experience in my everyday consumer life, why shouldn't I get that quality of experience in my professional life? So that's what's driving this. And I'll give you a quick story. My wife is a pediatric nurse at Boston Children's Hospital, and she says that doctors use their iPads all the time. And the way they use them on the floor is during rounding. And what they'll do is they'll bring their iPad in, and they'll have all kinds of like kid games on it, and they'll hand the iPad to the kid to distract them while they're doing an examination. So the kid's playing a game, and they can get what they need to do done, and then they move on to the next patient. And guess what they do? They hand that iPad to the second child, and again, they get them distracted, and they can do their thing. They can do their examination. That sounds fine, except when you think about what's actually happening there. Has anybody ever heard of infection control? I mean, when this was found out, this was, immediately you had to put a stop to it. It's like, are you wiping down an iPad between every patient? What about MRSA? What about, all the other infection control issues that we have to deal with? So being able to let them come in and use the devices they want, but at the same time manage them and control them and have visibility into them is something that has to happen. And that happens on the network. So we can provide that visibility into that user and device management. And it's really, once once the person is assigned a device or choose a device, or they want to bring their own, they're all going onto the Wi-Fi network, right? Everything has Wi-Fi, and everyone claims that all of them work well, but that's not always the case. So again, in the instance of, devices, we have all kinds of medical devices that are now being created that are Wi-Fi enabled. Well, the manufacturers are mostly medical device manufacturers. They're not networking people. So their goal to get these into the healthcare organizations was to give them connectivity. And that's it. They didn't think beyond the connectivity. So they bring them into your network and they just put them on there. Well, as we'll discuss in a little bit, there's huge risk there. There's a lot of risk there that needs to be addressed. So IT needs to evaluate each device and determine the best means to add them to the network. And I'm sorry, there's somebody needs to go on mute, I think. Thank you. Yeah, so I mean, if you think about IEC 80001 and the other guidelines that dictate, what we need to understand about how these devices are behaving, there are changes and there are regulatory changes that are coming around that are going to help us. But in the meantime, the network access control and the analytics are a means to monitor the behavior and enforce compliance of how you want these devices to behave on your network. And they require intelligent control, right? They're moving away from the legacy wireless networks. They're going all into IP and Wi-Fi. And the delivery is often disjointed. There's lack of visibility into device location. You have network, whether it's a cow, whether it's an infusion pump, whether it's some other device, knowing where they are is important. So we actually have an healthcare organization that just sent a request to us that basically said, where I can't find all my pumps. Is there a way that you can help us find our pumps? And the answer is yes. They were connected to the network. Even if they're not connected to the network anymore, we can run a report and tell you where they were connected last, so that you can go and find your pumps and make sure that they're available for that next patient, and make sure that you're providing efficiency into your everyday workflow. And in interest of security, so I don't know if any of you on the call were affected by last week's DDoS attack that took down quite a few sites and quite a few applications up and down the East Coast, the West Coast, and through parts of Europe. I know it affected, quite a lot of people. Well, that has been traced back to the Internet of Things. Some of the ways that got into networks was through Wi-Fi enabled cameras that weren't secured. So when you think about all of the devices that are now Wi-Fi enabled in the healthcare environment, you begin to understand that there's a level of risk there that's unacceptable, that needs to be addressed. And the FDA is taking notice. They've been taking notice for a few years, but before it's really was fairly broad. And hey, listen, we have these things connecting to your network. Let's keep an eye on them. But as time went on, this became much more granular, and I'll give you a perfect example. So the FDA sent out an advisory, and this is the first time that the FDA has ever sent out an advisory, not based on how a device operates with a patient, but based on how a device behaves on a network. And what was found was these infusion pumps were hackable, right? They were hackable through FTP and Telnet. And so the advisory went out and said, look, you need to take every single one of these infusion pumps off of the network. And if you think about traditional networking and say you have, infusion pumps across 22 health centers, and there's 10 to 20 of these at each center, and then you have to dispatch IT folks to go to all the closets and log into and start editing access lists. It becomes a very onerous and painful situation. But it needs to be addressed, because what are infusion pumps? They're delivering medicine into a patient. And if you think about infusion pumps in cancer care where they're delivering chemo, it's poison. They're delivering poison into a patient. So if you have a device that is now directly connected to a patient that is hackable, and hackable in a way that its behavior can be changed, then there is a huge, huge security risk, a huge, huge patient safety issue that has to be addressed. If you have visibility into your network and you have the management and control from a single pane of glass, you can go and find all of those pumps across 22 locations. You can quarantine them immediately across those 22 locations, or you can simply fix it, because what we're providing is not firewalling. We can provide firewalls at every port. So at every port, you locate where the pumps are connected, and then you turn off FTP and Telnet, and you're done. You just fixed the issue, and you can keep those infusion pumps in play, delivering care to patients, as opposed to taking them off, figuring out how to manage this and get your network configured so that create VLANs that you're now going to have to plug in all these pumps, and that's a huge resource issue. As opposed to being proactive, having the visibility and the ability to control from a distance, you can manage this and keep these things in play and keep them delivering what they're supposed to be delivering, which is patient care. So, and again, when you think about these manufacturers of medical devices, most of them aren't networking people, right? All they thought about was, I need to get this connected. And so once it's connected, it's not my deal. That is changing. There are regulatory things that are coming down the pike that are changing that. But the fact that healthcare leads all the other industries in terms of the adoption of the IoT, of the Internet of Things, it becomes paramount that the network itself be the tool that's used to protect the healthcare organization. And so, it's more than just the Wi-Fi, right? It's the core to the edge, it's the wireless, it's the switching, it's the access control, it's the analytics, and it's being able to bring in resources when you don't have them to help you deliver this, or to help you build dashboards that are based and developed on your particular environment, so that when you have some new IT person come in, they can immediately get a feel for what's going on in the network. Because you have that customized dashboard, they can give you the information that professional needs to do to help protect your network. And so, just to talk a little bit more about IoT and healthcare, right? It's the proliferation of Wi-Fi enabled devices is astounding. It's one of the ones I like to talk about, just because who'd have thought, is IP-enabled soap dispensers, right? And the reason that they now have this as a product is because if you think about infection control, and you think about a clinician going from room to room and seeing different patients, typically there's that antibacterial soap dispenser right outside the room, And, you know, what Joint Commission tells us is that you have to, you know, make sure that you wash your hands before you see every new patient. But we all know that, you know, that doesn't always happen. We have big issues with MRSA outbreaks throughout healthcare in the United States. And this is spread because not every clinician is following best practices and, you know, making sure that they're washing their hands. So IP-enabled soap dispensers, they actually read the ID badge of the clinician. They know when the clinician, what time the clinician washed their hand based on the appointment, who's in the room. And then they go to the next room and again they wash their hand. It's recorded, it's put into a database so that they can then track, you know, what's going on. So if there is an infection, then you can actually triangulate and figure out where it came from. So this is, again, using IT technology as a clinical tool, being able to deliver clinical outcomes based on behavior on your network. And it's that visibility and the proactive monitoring of the devices that really is paramount. So we actually have a large urban healthcare organization that needed to secure connected medical devices, and they needed to be able to find them so that they could address patient safety and reduce operational costs. So it was our management and analytics that actually were able to do that. And being able to deliver all of that from a single pane of glass really is what we're striving for and what we're trying to get to. So, you know, what is the secure foundation for intelligent health? What are we trying to deliver? You know, we're really trying to turn the network into a clinical tool. I mean, it may be as simple as I can't find my pumps. You know, the pumps are missing. People are hoarding them. You know, they have their favorites. Or I can't find my cow. You know, people, again, are hiding them. They can't find them. So we can help do that. And we do that with pervasive wireless, right? Everything's connected, so everything's visible, right? Or it could be, you know, access control. You know, who's accessing the different applications? It may be that in the back clinical area of you know, your center, you want all of your clinicians to have access to your EMR. But maybe you have a cafeteria or you have somewhere that you're delivering, you know, networking services to that's public. So maybe you don't want those same clinicians to have access to the EMR when they're in a public environment. We can do that. So we know who the device belongs to. We know what their role is. So if they're in a patient area, absolutely, you can access PACS, you can access EMR, you can access all the other critical applications. But when you're sitting in the coffee shop having a coffee and you're in a public place, guess what? You don't have that same access. It's not there. And it's so we can do geofencing around what we're doing. And, you know, we can also, you know, based on the user and based on the experience, we're trying to drive that quality of experience, not only for the clinicians, but for the patients who are visiting. You know, all the patients are visiting, you know, they're carrying around smart devices, they're connecting onto a guest network or your network, and, you know, it's all about the patient experience. They want to be able to have the same kind of access to networking that they do at their home. So, you know, in some instances, when you think about things, I mean, this is for hospitals, and when you think about HCAHPS, you know, that patient experience and satisfaction rate actually drives financial penalties and rewards. So, you know, for the CFO of an organization, what that means is Netflix is sometimes just as important as Epic or Cerner in terms of providing services across the network, because they're trying to drive that patient satisfaction level and make sure that they're meeting those regulatory requirements that we now have to face. So, you know, being able to use that, being able to say, okay, in this section we want to have, you know, full access to Netflix, but over here we want to throttle that. We're going to throttle YouTube, we're going to block this. So just based on the different applications and the different things that users are using on your network, you can customize and manage it in a way that makes the best sense for your environment. And doing all this in a secure fashion, right? Being able to make sure that you're providing the best possible IT service to your organization that helps them with HIPAA and HITECH and protecting PHI, that helps them secure these devices that helps them get a clinical baseline for all of those connected devices that oftentimes IT doesn't even know they're there. So, you know, being able to get the, okay, I have this many devices connected to my network, what is their standard behavior? What should that look like? And once you have that baseline, then you can compare and then you can monitor and you can be proactive and you can say, okay, this is behaving differently. What's going on there? We need to take a look at that. So rather than being reactive, we're now trying to deliver an intelligent network that lets you be proactive for your organization. So you're not just responding to emergencies and, you know, trying to put out fires. You're actually able to take the matches away from that rogue application before the fire even starts. So I would like to thank you very much for spending some time with me today. And I think we'll probably open it up for questions right now. And again, my name is John Moynihan, and it's been a pleasure talking with all of you.
Great. Thank you so much, John, for that presentation. Like John said, we are opening it up for questions now. And as I mentioned earlier in the introduction, you can either type your question into the question box, which is located on the control panel, or if you would like to ask your question directly over the line, please use the raise your hand option. That will allow us to unmute your line so you can ask your question directly to John. In the meantime, I just want to go over a few things. So our webinar today was recorded, and we will be hosting it on our website for you to view, but we will also be emailing it to you. That way you'll be able to share it with any of your staff that you'd like to share it with, or anyone else. If you missed anything, you can review it later on, and that will be sent to you probably tomorrow or the next day. And like I said, it's always hosted on our website to view in the future as well. So I'll just leave the line open here for a couple minutes to see if we have any questions coming through. And please, like I said, raise your hand, or you can type it into the control panel. It doesn't look like we have any questions coming through, but if you'd like to ask a question later on, you can see John's email address here on the page. We'll also have that linked in the email when we send you the follow-up with the recording, so if you feel more comfortable asking a question later on, please feel free to do so. But in the meantime, I just want to thank John for being here and being our presenter today. We really appreciate it, and we hope that everyone on the call was able to learn something today about patient security and network stability.
Thank you, Brittany. And again, I want to thank the Commonwealth Purchasing Group for the opportunity to speak with you all today. And again, if you have any questions or issues, you can reach out to me directly at my email address on the screen there.
Great. Thank you so much. And thank you, everyone, for being with us today. Have a great day.
Thank you.